Okay, here we go.
And if you miss it, you miss it. We'll give you audio this time.
Well, the music has begun. That means the Healing Docs are in the studio, and they're here because of you and for you. The Healing Docs from Absolute Healthcare. 3 locations to assist you. Make your appointment now at the Spring Hill office, the Port Richey office, or the Tampa office. Either way, you want to call Absolute Healthcare. Their local number in Spring Hill is 352-796-7171. That'll give you an opportunity to book an appointment at any one of the 3 locations. And, of course, make your appointment online as well at absolutehealthcare.org. That's absolutehealthcare.org. And the Healing Docs, once again, have brought you a ton of information, some very educational information for each and every one of us dealing with our health. Over the past few weeks, we've talked about weight loss, we've talked about falls. Of course, we're going to talk about, we talked about also sexual issues and overall sexual health, and now we're going to talk about blood pressure, which we heard hit a certain age. A lot of us deal with, if not most of us, deal with blood pressure and the complications that it may cause. So I'm going to turn it over to the Healing Docs. That's Dr. Malhotra, Dr. G, and Dr. Gupta. Both of our studios once again here for you. So welcome once again, both of you.
Thanks for having us.
Yes. And blood pressure, I'm sure you see this and hear about it all the time. Probably on a daily basis you see it there in your offices. But before I even go to a doctor, or before I even call Absolute Healthcare, how do I know I have a problem like high blood pressure?
Okay, so a lot of the times, many people that have never dealt with blood pressure issues in the past may not have a blood pressure machine at home. Or maybe they have one at home that belongs to a family member that deals with blood pressure and they've tried it on themselves, or they go to a local pharmacy when they're picking up a prescription or an over-the-counter medicine, and they'll try to do their blood pressure. And then sometimes even at little screening fairs and places like that, people will actually have a setup outside and at a local market and actually will do your blood pressure for you. So when you start seeing numbers, it really can get confusing. So a lot of the times when you're outside of the hospital or the clinic setting, they'll use things like green, yellow, or red to indicate, this is something you should watch out for. Maybe you should get checked up by a doctor. So that's a place to start.
So very important to know, of course, is to point out that there will be no symptoms.
Yep, absolutely.
It is also called the silent killer.
Right.
It is the number 1 cause for death in the entire planet. It is the number 1 cause for patients visiting our office. It is so common that if you are not checking your blood pressure routinely, at least once a year, you're doing yourself a disservice and not really taking care of your body.
Well, every time you go to the doctor's office, especially Absolute Healthcare, you're going to check our blood pressure there. You're going to check that.
Every single time.
Yes, sir.
We're going to bug you.
That's right.
Yes, you may not like it, but we have to do our job for you.
And technology has come a long way over the years. We used to have the little pump up, blood pressure monitors and, have to use stethoscope or whatever. But now we can do it at home with these nice little battery operated electronic devices. How accurate are those, by the way?
Well, actually, a lot of the old-fashioned way of thinking is exactly what you mentioned, where you do the stethoscope with the actual manual blood pressure cuff machine, which can be complicated and it can change between the interpretation from person to person that's performing it. So these new oscillometric devices, which are the newer battery-operated electronic devices that listen to the sound of your blood pressure, are much more consistent between devices and much more accurate. But what we usually do to begin with is, if we're going to allow a patient to use one of those, we'll check the recording of their actual machine that they use and compare it to what we have in our office with more medically strict devices. And when we know and we're comfortable with what the machine is doing for you, then we can send you home with that machine from wherever you picked it up. And you can get them very cheap. We also offer them at our practice at an even more reduced cost than typical over-the-counter prices.
It's so important.
Dr. Gupta and I were talking this morning, and he said when he was in training, his trainers would insist that they do it manually, that they check it themselves with their own ears. But now data shows that it's just not the right way to go. If you want a standardized monitoring, just like stepping on a scale, you step on one scale compared to the other, the weight's going to be different.
Right.
So you want to try and maintain the same brand, same scale, and that's how you can actually maintain some standardization in following what your pressure is doing. So these machines that you can buy for $20, sometimes under $20, are a great way to start and keep the same machine as we control your blood pressure if there is need to.
You bring up an interesting point, because you had mentioned bringing that machine into the doctor's office with you. Now I know why, because it does store those numbers, and you can set the date and time on there too. Yeah,
that's right. And also, what I realize these days is when I go to a pharmacy, earlier there used to be these cuffs where you could put your arms in. Somehow they've vanished since COVID came on. So most likely in order to prevent transmission of infection, but that opportunity to just randomly measure your blood pressure at the grocery store is gone. So for a family, just buy one. It's $20. Might as well. It's a great investment.
Yeah. And then let's talk numbers now, because it had been for a number of years. 120/80 was the general numbers that we were looking at. And the American Heart Association over the past few years has raised those numbers. So let's talk numbers with the doctors here today.
How do you know so much?
Because I keep track of my own blood pressure. How's that?
Good.
Yeah.
That's amazing. So, Dr. Gupta, you want to go?
Yeah. So the thing about the numbers is, a lot of the times with the numbers and the changes with the sort of guidelines over the years, the normal has pretty much stayed the same. So 120/80, you're exactly correct to know that that's what we consider as a normal blood pressure. The top number is called systolic, and the bottom number is called diastolic. And those two numbers are what we use to determine if your blood pressure is either elevated, which is between 120 and 129, or between 80 and 89. That's considered what we used to say as pre-hypertension, but now we just call it elevated blood pressure. And once you start going past 130 as the top number, or systolic, or 90 as the bottom number, or diastolic, that's when we start considering it as hypertension. But there are caveats to that. So if you come into our office and we measure your blood pressure and it's elevated, it's 130 or 140 as the top number, then that may not necessarily constitute as a diagnosis for hypertension. We need to have a measurement outside of the clinic as well, unless you have an extraordinarily high number or some other disease to indicate that you may have had hypertension for a long time, such as heart issues. So in a sense, it's not just the number, it is the average of numbers between different places, where, especially in a place where we consider you to be comfortable, like at home. And the other thing is doing it properly. So we also instruct our patients, you need to sit down for 5 minutes in a relaxed state with both feet uncrossed, flat on the floor, with the arm that you're going to use to measure the blood pressure resting on a table close to the level of your heart. And those things are what keeps things consistent, and we avoid those natural increases in your blood pressure with activity, which is a normal response to physical exertion.
Not having smoked for 30 minutes, not having had coffee for 30 minutes. Excellent. So there are certain things that you just have to be in a relaxed environment, not talking while you measure your blood pressure. Don't say anything, don't turn the music on. And if you're in the office, don't indulge in chatting with the person who's taking care of you at that time. That's a moment to be quiet, because blood pressure is measured by sound. We listen to certain sounds that the arteries will make after we compress them, and then we allow that decompression. And if there is any interfering sound, it's going to interfere with the measurement of the blood pressure. So we want perfect silence in these circumstances, not having smoked or had coffee.
And I understand too, there's you got to do at least 3 times maybe just to get a baseline, or you take
at least twice. At least twice. Okay. And like Dr. Gupta was pointing out, that if you're not sure that you have blood pressure or not, we'll send you home with a monitor.
Okay.
We want you to measure it twice a day for a week.
Okay.
You bring it back, we take 12 of those readings, we discard the first couple of readings, and then we average them out.
There you go.
And then we look at each number average, the top number average and the bottom number average, which means the systolic average and the diastolic average. And if they qualify, that you should get treatment, because treatment has the greatest impact on your mortality. on your morbidity. Morbidity meaning that having a stroke or needing dialysis in the future, or getting a heart attack, or going into heart failure, or not having the capacity that you used to have. So all these things, the entirety of it is important. So at certain levels, we have cutoffs. Cutoffs are targets for, let's say, a person who's had diabetes will be a little different, person who's had a stroke will be a little different. So these kinds of things all factor into deciding who should we initiate treatment on.
And we're more concerned here with high blood pressure over low blood pressure. Is there a big difference?
Yeah, so just like with anything, we don't want the numbers to go in any extreme direction.
Okay.
If it's extremely high, you can be at a very high risk of dying in short amount of time. And when I say extremely high, I'm talking numbers greater than 180 all the way up to 200. Even higher numbers I've seen in the hospital setting in the past. The other thing is, if it goes very low, just like with blood sugar, you can't survive without an adequate amount of pressure, which is what supplies the blood to all of the vital organs in our body. And just like with blood sugar, for diabetes, which I believe is going to be a topic we do discuss in the future, it's something that can basically injure you or kill you if it's extremely low very quickly. What we're talking about with hypertension is doing things properly, which is why we don't want to just jump to giving you a medicine to lower your blood pressure if you just come in with one abnormal reading to begin with. We want to make sure what we're doing is treating you and providing a benefit to you with the lowest risk possible. So yes, we don't want it to go too low, which is why we want to measure things and know where your numbers are with and without treatment, and get you to a point where you're going to reduce your risk of dying or having severe disease in the future with the lowest risk of an acute event or a sudden event of, putting yourself at risk with very low numbers either.
So lifestyle change, of course, is a big factor here. Some things that we need to change, like myself personally, I like to set my doctor's appointments in the morning, and I'll have my coffee in the morning already. I'll rush, maybe because I'm running late, I'll rush to the doctor's office. I get there and they take my blood pressure right away. I don't have time to relax, and my blood pressure is always high when I go into the doctor's office. So a lifestyle change for me would be something like, maybe I should cut back on that coffee if I have a doctor's appointment that day, and just take it easy. Don't stress myself out.
Yeah, have a glass of water. Have a glass of milk if you like that. And once you get there, take it easy. Let them do it a couple of times, particularly if it's high.
Yeah.
And what I suggest to people is bring me the numbers from your house, because those actually represent what's happening to you during your routine life. You're going to be with me for 30 minutes, max an hour. And I'm not going to decide your entire life based on just that short period. So it's so important that you bring in your logs, your lists of problems, etc., so that we can actually give you better treatment.
And other than cutting back on, say, caffeine and stress, what other life changes are important for this?
So the biggest impact on reducing a person's blood pressure if they do have hypertension and also obesity or being overweight is losing weight.
Okay.
There is about, for every kilogram, which is about 2.2 pounds of weight loss, if you are already overweight or obese, is associated with 1 to 2 millimeters of mercury, which is the measurement we use as the numbers for your blood pressure. So 1 to 2 points drop for every single 2 pounds that you're losing. So if we get you down 20, 30, even 40 pounds, you could lose a significant amount of blood pressure points, up to 20 points just from that.
And with our weight loss program, we have seen that happen to so many patients. We've had to take their medicines away.
Right.
Yep.
So you don't require the medicine anymore. Complete change. No diabetic medicines anymore, no blood pressure medicines anymore. So weight loss is, like Dr. Gupta points out, is an amazing thing to focus on if you have excess weight.
Yep. And another thing that contributes to a significant drop in blood pressure points, aside from weight loss, is the lifestyle changes that we recommend with exercise and diet. And this is why all of the topics we're talking about all of a sudden seem to make a full circle, right? We're talking about the weight loss, we're talking about the lifestyle changes, we're talking about the exercise, and we're talking about diets. The diets that are specific for high blood pressure and reducing it are usually focused on increasing the potassium in our diets, as well as decreasing the sodium in our diets, as well as increasing vegetables, natural foods, and reducing the amounts of fats and cholesterol in foods in our diet. So those can drop your points, and adding all of these together can have a huge impact on blood pressure reduction. And these medications that we use don't necessarily have to be a lifelong sentence, for hypertension. We can get your numbers down to a point where you're only on one pill instead of two, or no pills instead of one. So it's an important thing to know that we always are measuring blood pressure, not just because it's a habit, but because we need to know where your numbers are and where they've been and your trends, and see if a treatment is still correct for you.
So we don't have to be on blood pressure medication our entire lives then?
We've taken people off of their medications.
That's awesome.
So lifestyle definitely has a huge role to play.
Yeah.
Stress has a huge role to play. There's a study that shows that if you hug somebody you love for about 6 seconds, don't just hug and leave them, your blood pressure could drop 5 to 6 points. So there are so many things that you can do for yourself where medicines will become unnecessary.
I even understood and have heard in the past that they've done studies on pets as well, help lower your blood pressure.
No doubt.
Yeah.
Dr. Gupta was just hugging the little dog running around your studio today.
Yes.
Yeah, and see how calm he is?
Yes.
You learned
Blood pressure is nice and low right now.
Amen. You learn so much on this show. That's why you listen in every Sunday at 9 o'clock, and that's why you need the doctors at Absolute Healthcare. They're here for you every Sunday, and they're in their office, 3 locations to help you as well. Make your appointment with Absolute Healthcare LLC, Absolute Healthcare. 3 locations, Spring Hill, Port Richey, Tampa. You go online at absolutehealthcare.org, talking about the main issues that matter the most to your health with Dr. Malhotra and Dr. Gupta. Okay, so blood pressure medications, let's go there. How do I know I need to start? When are you going to put me on blood pressure medications? And what's the best one that I should take? I mean,
You want to go?
Sure. So we were actually interested in this just the other day when we were thinking about, what would be some of the common questions that we would be asked as a physician about what's the best blood pressure medicine?
Mm-hmm.
When should I start? So the thing is, there's a lot of analogies we could use, but the best thing to say would be, it's not necessarily the type of medicine that we use to lower your blood pressure. There are guidelines and recommendations that we can talk about with the patient in person. But what matters is getting the points to where we want them. So if we get the points down to a reasonable number that we think is keeping you in a safe zone over the course of a few years, where the real data is showing that we're reducing your risks of dying or having severe disease, then it really doesn't matter which medicine we use. And certain medicines have different types of side effects or could cause certain symptoms that we would think is unfavorable for a person. So we tailor those things to a patient. We know what other medications are on, and sometimes there are certain blood pressure medicines that are also used to treat different types of diseases. For example, heart issues usually use one type of blood pressure medicine. Anxiety issues can also be treated with some certain types of blood pressure medicine. Thyroid issues, and I could go on and on. So sometimes if we can, to be crude, kill 2 birds with 1 stone, we will do that and keep the medicine burden on a patient down and get to the same results that we want.
Of course, there are some combinations that have shown to perform a little more superior than others.
Correct.
And then, we look at the medicines that the patient is on. There are some combinations where even though the blood pressure may not be as well controlled, the survival of that patient is better.
Yeah.
So we try and tailor to those types of medicines and combinations, which will come in the long term. But the immediate need is to get your pressure down.
Right.
But thereafter, we start to tweak things. Initially, we want the numbers down. For the long haul, we want the best possible combinations on.
Is that a hard theory? I mean, is that hard practice to do that, or is it fairly simple?
I think if you are not trained and retrained in medicine again and again, you might be doing something that is 20 years old. For instance, there are lots of people who are currently on just beta blockers. And those have gone into disfavor. We no longer want to use them as monotherapy or single agents unless there are extenuating circumstances like heart failure or having a heart attack. So we want to get away from those medicines as single treatment. Like you might have heard of drugs like atenolol or metoprolol, and put them onto little better agents. And even if we have to stay in the beta blocker category, we can switch them over to things like carvedilol or nebivolol. So there are options where we want to take people away from certain medicines. There are now there have been studies to show that the medicine hydrochlorothiazide, for instance, might not be as superior to other drugs in the same or similar category, like indapamide or chlorthalidone. So we do try and tweak it for the long haul to something that we think is going to be much more favorable for the patient.
Any natural supplements or any natural medications that we can try and take it home maybe on our own? Or
So I think that the best natural things that you could do for yourself right now is find things that are higher in potassium and lower in sodium in terms of your overall intake of food.
Okay.
And those are where really the biggest studies and data is showing the trends. Now, when it comes to specific, over-the-counter blood pressure reducing pills on the market that are not prescribed, again, it's going back to the same things that we've talked about in the past on this show, where there's just not enough data or evidence that has clinical trials that's proving it to be better than something else. So we can't stand behind those necessarily, and we don't necessarily know what goes into them because they don't have such rigorous processes that the FDA does for prescription medicines. So I would generally, again, say it's not really recommended to go and buy over-the-counter things. What we would recommend are really what's in the diet. Okay.
So low sodium, higher potassium,
Yep.
higher magnesium, higher calcium, which is what the DASH diet is typically comprised of, foods rich in these substances, and lower in sodium.
And you need to be open and honest with your doctor as well. I mean, you need to let the doctor know if you're taking extra supplements like this on the side or any kind of vitamin you do, maybe bring them into the doctor's office, right? Everything that you take.
Absolutely. Because a lot of the times a patient will tell us what medications they're on that are the prescribed medicines, and sometimes things are, something's going on that we can sense that doesn't seem right. Something may seem like there's what's causing this or this to happen if we think we know everything that they're taking. But a lot of the times you find out, you dig a little bit more, and they're taking 5, 6, 7 different over-the-counter supplements that are probably not even necessary. And we definitely don't recommend just spending money if there isn't evidence and scientific proof to show that they work.
Correct, particularly during retirement. You must conserve every penny that is otherwise just being spent blank without any returns. So these medicines, that supplements that you're buying, even if you think they're not hurting you, financially they are. And over the years, that number does add up. So, and with the inflation these days, you better conserve every penny that you have so that you have a comfortable retirement in the future.
Yeah, enjoy your golden years. You don't want to have to go back to work just because you're throwing money away on little things like that.
Exactly.
Yeah. And plus the interactions too, right? That some of these vitamins and supplements may cause if you are taking prescription medications.
Absolutely.
Yep. And then one other thing is a lot of these vitamins and supplements will have overlap with what's inside of them with the other vitamin and supplement you're taking.
Good point.
Some things that you just urinate in, on a daily basis, it's usually not going to hurt you. But some of the types of vitamins, we store them in our body, and we don't want those to get to a toxic level. Dr. Malhotra's already mentioned about iron in the past, and also vitamin D, vitamin K, A. Those vitamins, we store them in our liver, and we don't need them on a daily basis, and can certainly get to a point where it's considered toxic. And those are extremely hard to diagnose because they usually don't have typical symptoms that we would expect. And they can be things from skin rashes, things with cracked lips. So it really is difficult to determine what's going on when a person is taking medicines that we don't have the scientific evidence and data to show what's it used for and does it work and what the side effects are of them.
And it's not like studies have not been done. Studies have been done on these vitamins, and those that have no benefit, we say no, stop them. So typically, if you don't have a deficiency, except for vitamin D, we do not recommend any other vitamins. And even if you don't store them in your body and you're peeing them away because they are water soluble and they get out in the urine, you're just creating expensive urine.
Yeah.
That's it. There's nothing else.
Yeah.
You're not really benefiting anything from it. So yes, don't unnecessarily just go and buy these things because you read it somewhere.
Well,
Discuss with a qualified physician who is conservative and realizes that this is not something that you need and is not one who actually sells them. You might be going to a physician who actually sells all this stuff, and he may have a secondary gain from pushing these substances, which we in our office do not have.
That's true. Bring up another good point. We always hear the great points from the health healing doctors right here on this show, the Healing Docs show, brought to you by Absolute Healthcare. That's why you need to reach out to Absolute Healthcare today. So about 3 minutes left, gentlemen. I'm sure there's something we forgot here.
Yeah, so I think that, again, when it comes to an individual, a person, we don't take a blanket approach to all people with elevations in their blood pressure. Sometimes they may have a different type of disease that causes elevations in the blood pressure that should be addressed first. And maybe that's the reason what's causing the blood pressure to be elevated. So when we diagnose hypertension, we need to know, is the hypertension because of what we call essential hypertension, where it's just due to you having that disease isolated in itself, or is it due to something else? And typically we can identify that based off of different types of findings that we can see in the clinic. Are they on multiple blood pressure medicines and we're still not at our goal? Are they also having a thyroid problem? Are they also on medicines that can increase your blood pressure, like testosterone replacement therapy and other things of that nature? So we don't just take a blanket approach to all patients, and we make sure that we're getting to our goals the way we want to, and we're making sure we know what it is we're treating in the first place. So definitely see a qualified doctor, especially if you're noticing that your numbers are above 120/80 if you're taking a blood pressure measurement at home and haven't talked to a doctor about it.
I think it's very important to go into a practice where there is education and continuing education going on within the practice. For instance, in our practice, we teach medical students, we teach residents, we teach nurse practitioner students, physician associate students, we teach medical assistant students. So the entire spectrum is there. So starting from teaching how a medical assistant should actually check his blood pressure, to the extent where we ourselves educate each other as fully qualified professionals, I think we have that quality which we can deliver on to the benefit of our patients. So bring us your numbers, bring us your medicines, bring us whatever else you are taking that you think impacts your health, so that we can actually guide you clearly.
And these doctors are truly on your side. They're in your corner. They're the healing docs, and they want you healed today and living your best life possible. Absolute Healthcare, it's a show every Sunday at 9 o'clock here on this station called the Healing Docs Show, brought to you by the doctors at Absolute Healthcare. Dr. Malhotra, Dr. Gupta. Gentlemen, we brought a lot of information to the table. Next thing you need to do is take the next step and make that appointment at Absolute Healthcare. And we'll see you next Sunday right here, same time, same station. God bless you, gentlemen.
Thank you.
Thank you so much for the opportunity.